guys, welcome back to another episode of the Fill Me In podcast. I'm Injector Jon.
And I'm aesthetic nurse Nicole.
And welcome back.
Yes.
And don't judge my lovely face if you're watching me on YouTube, because I had a TCA peel and my skin's currently peeling off my face.
I can tell it's like so ready to go. Like every
so
movement
ready.
you're making.
Do you see that ripple? I mean, and I'm very shiny.
Yep. It is ready to peel, baby.
Oh God. I'm trying not to like peel it.
You have to.
I have my scissors.
Yep.
Yeah. Mm-hmm. It's very hard.
I know, because when I did the ZO3 step, I've done it like 3 times. It's one of my favorite peels, but my forehead, because I'm usually Botoxed, doesn't move. So everything peels, but my forehead. And then I feel the urge to peel it myself. And then every time I do it, I'm like, why'd I do that? It's like worst. It feels like the worst sunburn in the world when you do that.
Yeah. And it's like red for like a couple days because, oh my God.
Yep. You're not supposed to do that, everyone. That damages your skin.
Also, the amount of movement you have, Nicole.
Oh my God. It's actually, did you see me crying at my shower? It was actually so insane.
And I'm not going to lie. It made me cry. So watching you cry, number one. Number two, it also made me uncomfortable seeing how much movement you have.
My forehead. And like, look at when I look
Nicole, I can't tell you my anxiety. I think I just got a PVC. Like
my angry face. I've never in my life
had that.
Oh my God. And my crow's feet. Don't even get me started. I have not seen those since I was 25.
Oh my.
It's so funny though. Like I'm just owning it. Like even in all my pictures,
what are you gonna do anyway?
Right, exactly. But like, I feel like some people would edit that. Like I posted all my shower pictures with my crazy faces. I'm like, listen, we all have it, okay?
No, I mean, what are you gonna do? I get it. We don't want our child to have botulism, so
we'd prefer to keep him safe.
We prefer to keep him safe. But you are not breastfeeding, right?
So I'm going to pump for a little bit, but we're gonna combo feed. So we're gonna breastfeed in the beginning, but right off the bat introduce formula.
Oh, that's nice. Yeah. Okay, cool.
So that I'm not tied, and because it's tough, and I don't want the baby to rely fully on me. Kevin has to be able to feed him, and
of course,
so we're formula introduced immediately, but I'm gonna try to do like a little bit of the colostrum, I
give any woman credit that breastfeed. I really do, because I feel like it's a full-time job.
It is a full-time job. And then your baby, especially if they're fully breastfeeding, they're reliant on your nipple, like you can't.
Well, that's it. And plus
bottles and stuff doesn't happen. Yeah.
I feel harder to get them into the bassinet or like into their crib, because they're so used to holding. It's like a comfort.
Soothing
it's like
with you. Right. Yeah. Again, this is my first one, so we'll see what happens.
What happens. I know.
But yeah, my plan is to combo feed immediately, because my husband, everyone always thinks I'm like, it's so funny. I had a patient ask me like, oh, like, what are you doing for childcare? I'm like, my husband. And they were like, oh, like, yeah, he's going to stay home with the baby.
Yeah.
But so we need to combo feed right off the bat, because there's no way I'm going to have enough, storage of breast milk.
And luckily
for
you're going to be taking some time off, which is nice. So you can like enjoy the time with your newborn, which you need to do.
Yeah, exactly.
But we're going to be talking today about how our lifestyles can age us. Okay. And there's a lot of different factors. And one of them being sugar. That's huge.
Yep.
Another one being the sun, obviously, which we all need vitamin D. Oh my God.
I know, but I take my supplements.
You're fine. I know you're fine.
But no, if you're like in the north, like we are, you have to take your supplements. We don't get enough sun.
Yeah, but lifestyle, guys, plays such a huge role. We see it every day with patients coming in for consults, especially people completely naive to Botox or fillers, right? Yep. And they're sitting in our chair and they want us to fix them within one treatment session, right? Which is just not the case.
Not possible. Yeah.
But sugar actually causes glycation. And for those of you that don't know what glycation is, basically
Tell us.
Oh, here we go. You ready?
I'm going to sit back.
I'm pissed because I love sugar. Don't we all? I have such a sweet tooth. It's so bad. But basically when our proteins like collagen and elastin, which are proteins, right? When they're exposed to sugar, those proteins glycate, they break down. Basically think of it as like you have a brand new shiny car, right? And then all of a sudden over time it develops rust. Okay. So basically that that sugar causes rust over time to form, and it builds up in our skin tissues, and it causes us to age.
How dare it?
How dare it? And there's a lovely new product on the market, Skin Better Sciences, the BioRewind, which is lovely. I take it every freaking day for the past month. It's wonderful. I've actually seen a huge difference in my redness, Nicole. I haven't talked to you about this.
Oh, interesting.
Yeah. And what BioRewind does is it's basically preventing glycation. So when I'm eating sugar, it's preventing those proteins like collagen and elastin from breaking down, which is great. And it's keeping our skin more youthful. And when we all know this, sugar causes inflammation. So if we have that not happening, we're going to have less inflammation within our bodies. And whenever we have more redness in our face, rosacea, usually there's something underlying going on causing that inflammation to occur. And think about it, like diabetics age quicker, right? Than the normal human being that isn't. And it's because the diabetics have a higher glucose level in their body.
And it's not just for like beauty purposes. Like if you get a cut or something and you're a diabetic, you do not heal the same as someone who's not. You have delayed
wound healing.
Yep.
Exactly. 100%. So sugar is a huge, huge factor in the aging process. So if you're someone who loves your jelly beans, yes, you can have them every Easter. Oh, same. I love a good peep.
Oh God. A stale one though. I gotta I love stale peeps.
Stop it right now.
You got to open the package and leave them open.
And leave it open for like a couple hours and then have it. Oh.
Yeah. It makes all the difference.
I thought that was just me.
That's hysterical. There's like a fresh peep is just, ugh.
My husband hates stale peeps.
Oh, no.
Love me a good stale peep.
Same.
It's a little crunchy.
So
it's great.
good.
If you have anxiety, it's great. It's a little crunch.
Thank God Easter's right around the corner. We can get these.
I can't. Oh my God.
But BioRewind is available at Jon's practice and mine. So if anyone wants to try it, yes.
It's wonderful. Yeah. And actually, after just talking about it, like on our, like social media and stuff like that, I've actually had like every time I'll look over at like at our shelves and I'm like, oh, there's 2 that are gone.
They're missing.
They're missing. Like they're being sold. So people are very interested. And it's really funny. Like there's so many people now that are on supplements. They take them daily. And, supplements are very big now. And wellness is huge. So, it was definitely an easy sell for sure.
Like what's another pill? We already take 10.
Exactly. Yeah. But I also wonder though, like if you're taken BioRewind and it's preventing glycation, it's probably good even for fertility and for other issues. You know what I mean? And autoimmune disease.
Right. I would think like arthritis and things like that too, because you're helping the inflammation everywhere, not just the face. Yeah.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Secondly, let's talk about vaping and smoking.
Don't even get me started. It was so funny. Me and Kevin were driving the other day and there was a guy walking down the street smoking a cigarette. And I was like, people still smoke?
I know.
Like, how is this a thing?
I know.
With everything we know. And you know what? Alcohol too. How are we still drinking with what we know about alcohol?
Oh, I know.
Like it's just things that, and please, I'm guilty of it. I love a good cocktail.
Yeah.
Not now, obviously.
I love a good
when I'm not pregnant.
Chardonnay. Yeah.
But it's like we know so much about it now that how are we kind of still allowing ourselves to do that to our body?
Yeah. I mean, I'm a huge whenever I'm talking to my patients, I'm like, guys, everything in moderation. I mean, seriously, don't overdo it.
Right.
And, I don't know. You have to live. You have to live.
Yeah,
how do we have this one life. We don't know what's going to be on the other side.
Right.
And you want to, if you're in Italy, have a glass of wine.
Have the glass of wine. Exactly.
Jesus,
it's same thing. It's just the daily drinking or, a pack of cigarettes a day.
Yes. And vaping.
No
my
bueno.
God.
Yeah. And the vaping,
it has nicotine. Anything I think that you inhale is not good for you.
No. And that's the problem with the vaping too, is it's made it so accessible. You can vape in bed. You can vape. Like you couldn't smoke a cigarette in your house because of what it would do to your house.
It's habitual.
Yeah,
how many people just have it in their hand?
Yep.
You know what I mean? At least with cigarettes, you have to light it up and you have to go somewhere to do it. But vaping, it's literally,
they made it so easy.
So easy. People are doing it in classrooms. I can't tell you how many teachers come in and they're like, oh my God, we had to suspend someone for vaping. I'm like, what?
God.
I'm like, stop
it's insane. And I'll tell you what, I can tell when people are smokers. I know. I know
of
when they're in the
course.
chair. I know your skin shows it.
It does. And not just because of your smoker's line, just
Right.
just in
Yep.
general,
Just in
your overall
general.
skin
Yep.
health, right?
Mm-hmm.
Yeah. I mean, it's literally, you're literally depriving your body from oxygen,
Yep.
right? Your body is going to age quicker,
Mm-hmm.
right? Especially if you smoke and if you tan. And people that smoke love coffee and they love to be in the sun and tan. I'm
Yep.
sorry, they do. They go hand in hand. It's like the triad,
Yep. Yep. I think
right?
too, because when you're outside, you got to smoke outside. Most people.
Mhm.
So it's,
But then people that are, they're boating or they're out like whatever on the lake or whatever, they're like, okay, I'm in the sun. I'm going to have cocktails. When you have cocktails, it's more fun to vape or smoke. So then, it's like the whole triad, right?
Yep.
And
Yep.
that'll just speed up your aging process. So
Yeah.
those are things that if you're doing them, stop doing them or just cut down,
Yeah. Yeah. And I think in smokers and drinkers, you see a lot of those broken capillaries kind of like around the nose
drinking.
and around the eyes too. But the smoking too, I just feel like it gives you that redder and like thicker skin.
100% does. Yeah. And, if you're continuously smoking and vaping while getting these advanced skin treatments done and doing all that, you're basically negating everything that we're doing. I'm sorry, you are,
Yeah.
and I'm not meaning that in a negative way. It's
No,
just like, if you're going to spend money on these things, like, don't waste it.
Right.
You know,
100%.
this stuff's expensive and we get that. But
And
anyway.
and smoking for sure will break down your fillers and Botox quicker.
110 million %.
Yep.
Because the nicotine, it increases your heart rate, increases your metabolism. Yes, 100%. It'll break down those fillers.
Yep.
What about side sleeping and stomach sleeping?
My worst nightmare.
Not a stomach sleeper.
Not a stomach sleeper.
Listen, sleep is so important, guys. It's so important.
However you have to sleep to get the sleep.
Listen.
A lack of sleep will probably be worse than side sleeping.
Wait. Good point. It's true.
But still, and I said this on a few episodes, I think, because I'm pregnant, I've been forced to sleep on my side. And it's like, I can't stay asleep because I am a back sleeper, like this. My arms are in the air like this over my head. I'm on my back.
I can't. Like you're tied. You're tied back. Like you're in handcuffs.
I have to use pillows to keep me on my side because I've just like trained myself to sleep on my back. So that's been a tough one.
Yes.
But I mean, we're lucky now that they've created pillows for this. So
100%.
you can sleep on your side without creating lines. I know you have a favorite one. My favorite one is Sleep and Glow. Has a little dent. You just turn to the side. The pressure is here and here, and doesn't create lines. Like a little dent in it for your face.
And then I use the Flawless face pillow, and it comes with a satin pillowcase, which I freaking love.
Oh, that's nice.
But it basically like hugs your face. So basically, there's one part of the pillow that comes up here, and then another part of the pillow that comes along your jawline. So it's like a V, right? So when you go to lay on your side, you're not smushing your cheek in and causing like those lines that are like under the eye or around the eye. You're not smushing this part of the face. You can tell a stomach or side sleeper from a mile away. Like, patients that are in their 40s, 50s, 60s, and they're complaining of perioral lines like all around their mouth. And like there's lines going each and every way, every diagonal, right?
Yep.
I immediately right away I go, are you a stomach sleeper? Like 9 times out of 10. How did you know? I'm like, well,
I could tell
because of all this area. And I know that's why you're coming in today, but the first habit that you're going to have to start trying to break is stomach sleeping. Well, I can't do that. Okay. Then there's things we can do. We're going to have to do some skin resurfacing because those lines etched a scar within your skin. We're going to have to do filler. We're going to have to do maybe some skin V, right? Just like smooth some of those lines. It's going to take time, right? And patience. It's not going to be overnight. But truthfully, like invest in, I'm sorry, I know these pillows are expensive. It's stupid. It's like $250 for my Flawless face pillow.
Yeah, I think it's around the same.
Is it about the same?
I think it's like $175, $200.
Can I be honest? I actually love it. And it's actually super comfortable,
right?
Especially if you're a side sleeper. These pillows are great.
Yeah, you can still smush your face. It's just that your face isn't actually smushed. And I think they're really too like they're engineered to also give you neck and back support. So that it's not just something for your face. Like it's actually supposed to help, the whole top half of you.
No, really though. And they're super comfortable and they're satin pillowcase. So it's less likely a chance of you like smushing
That's
you're
another
facing.
spot, that line, like you just went like this, that line right next to the eye where people are like, the Botox didn't get rid of that. I'm like, that's because you're sleeping every night, pushing your cheek up, and it's creating that little line right where your cheek and your eye meet.
Nicole, what about my 11s that won't go away and I'm sleeping like this?
Yep.
And it's causing these lines here. Have you ever seen those? Like people that have lines that go, they basically start almost in the periorbital space and they're vertical, and they basically are etched along the brow.
And sometimes they go all the way up the forehead.
All the way up the forehead. Yeah.
Yep.
And I'm guilty of it. There's sometimes where I'm like, my flawless face pillow. I'm going to use my regular pillow. I want 10 hours of sleep tonight. I deserve it. And I'll use it, but then I'll wake up and I have this large diagonal line here in the morning, and I'm like, shoot.
Like, oh my God. Yep. Shouldn't have done that.
Shouldn't have done that.
But again, the sleep is definitely your most important priority, because the lack of sleep is going to cause even more.
No, it's so true.
Issues, but
because that'll cause stress on your skin.
Right. Yeah. But you want to find a way for sure to sleep without causing those lines.
And guys, like seriously, like injectors listening in, like I know you guys see it all the time. I cannot get over the amount of people that still tan.
Oh,
I mean, have we not learned?
I know.
I know.
Like
SPF is the new tinted SPF is the new foundation. I mean, come on.
Yep.
And I've never seen so much more education. I mean, there's so much education now on skin cancers, more awareness about skin cancer. So there's more and more people using SPF, which is great. But like, I feel like the majority of people that tell me they tan, it's still because like, oh, I get breakouts here and there, and like tanning really helps my breakouts.
Yeah, because it's antibacterial. The sun is antibacterial.
Or like if you live in the Northeast, right?
Yeah.
Like people just love tanning because it makes me feel so warm.
Yeah.
And I just feel so much better. I'm like, I get that, but get a heated blanket.
Yeah. Yep.
And
be like me and sleep with your heating pad every night.
Take your vitamin D supplements.
Yeah.
Like what?
Yeah. And you need a good amount of vitamin D to supplement the sun. It's not what you think. You need to take at least 5 to 10,000 IU, if not more.
You do. But like, I think you're supposed to take like 2,000 to 3,000 IU daily. That's like the recommended, unless you're severely depleted.
And that's the thing, is a lot of us, especially if you're from where Jon and I are from, you're definitely severely depleted. You should get it drawn and checked, because it's not just aging things. It's also, it helps with mood and brain fog and all those things as well. So
yeah, not just bone health, you know?
Right. Yep.
I know. Another one too that causes a lot of stress on the skin, other than lack of sleep, is going to bed with your makeup on.
Yes.
And why is that, Nicole?
Well, one, you're going to clog all your pores.
Yes. But you're stressing your skin out.
Yes, you're causing havoc on your skin bacteria. Yeah.
At nighttime when we're sleeping, that's when our skin cells turn over. Yeah. That's when a lot of things are happening, collagen production. I always joke with people, I'm like, why do you have to take your atorvastatin or Lipitor at nighttime? That is when you have cholesterol formation overnight, right? Why do you have to wash your face at night and do a nighttime skin regimen?
Because that's renew overnight.
That's going to renew overnight. That's when you're actually going to see. Well, you're not going to see it because you'll be sleeping,
right?
But that's when
trust me, those little guys are in there.
Yes. Yeah,
they're turning over.
Yes.
And that too, like. That's why you want to use that time to put those important ingredients on your skin, like retinols and glycolics and things like that, because they're going to do so much more for you at night than they are going to do during the day, because of how that renewal works. Yeah.
Like there's just so much more awareness about what we're putting in our bodies now that's causing issues with our skin. I always say, if you have red inflamed skin, look from within.
Yes.
Right.
Well, I love that.
Yeah. And then also, like, if you have acne as an adult too, look from within. Like, you guys have wellness at your practice. Like, you guys are huge on hormones, which has gotten so popular. Like, Meg's amazing.
Yes. Yep. And it's actually cool because Nikki, our one esthetician, she's suffered with adult acne. She had great skin up until like a year or two ago, and they've been doing hormone testing, and then they did her fit testing too, which is that gut health testing. And she's cut out a ton of foods. And at this point she gets like 1 or 2, but now it's focusing on the scarring and clearing it up that way. So you can do
microneedling and things like that.
It's really cool to see, because she came off birth control, and it just wreaked havoc on her skin, unfortunately. So it's been kind of trying to get her back to a stable hormone, and then also removing any of those foods that cause an issue.
Yeah. I think it's like so important to address our patients holistically. Like I'm just huge on like anyone coming in my chair for a consultation on, for injectables, I'm bringing in skin. We've talked about this
Yep.
on so many episodes, previously to this, but it's so important to address the skin and skin quality because our skin has to support this filler, has to
Right.
support the injectables. That's what I normally say, right?
And if you do have those fine lines that are a little bit etched, like Botox, maybe after a few times will do the trick, but it definitely needs that support of microneedling or a skin resurfacing or something of that nature to help speed up the process and strengthen the skin. Because I would say, like, the Botox and fillers is great and they are going to be preventative, but they're not going to be as skin boosting as something like these skin procedures. They're a little bit more of a Band-Aid rather than actually boosting your collagen and elastin, and they do to an extent, but it's not quite like something like a laser or microneedling can do.
Yeah, no, 100%. So my practice just got SoftWave.
Wait, I saw that. I wanted to ask you about that. So exciting.
I'm so excited.
Yeah, tell us about it.
Well, I've been looking for a laser at my practice or even like a treatment, right? That isn't going to give a lot of downtime for our patients, right?
Right.
We have so many people that have to talk in front of, for a living. Right. They talk in front of people or they have meetings, this, that, whatever, and they just don't have the time for downtime. And I feel like, which I'm so happy about, right? Like we just said, skin health is so important now. There's so much more awareness around skin health and regenerative medicine, right?
Yep.
And so many patients don't want to go under the knife. So I was looking for something to lift and tighten the skin without downtime. And we have radio frequency microneedling. We have so many patients that love it. But it has downtime with it. So SoftWave is using ultrasound technology. And
I'm so sorry. I told you not to take that personally. I started these episodes with Jon. I have pregnancy has given me a yawning problem. And I said, please, if you're talking, you're not boring me. I can't stop yawning. It's because I'm growing.
For those of you that are watching us on YouTube, she just blatantly yawned while I'm talking about something I'm passionate about. So goodbye. Goodbye.
I'm crying. Oh my God. I told you that was going to happen.
No, I know. Listen, I get it. You're caring for someone else, like in your belly. I get it.
I am so sorry. I caught that midway. I was like, oh, sorry.
No, I died. I literally, as you did it, I go, oh no, she did not.
Oh my God. Sorry. So go on.
Oh my God, you're fine. Oh my God, I can't. So okay. So guys, for those of you that have so many questions on SoftWave, SoftWave is using ultrasound V-beam technology to basically stimulate collagen and elastin within the dermis. So it's only going as deep as 1.5 millimeters within the skin, which is incredible. So anything more than 1.5 millimeters into the skin is going to have the potential to dissolve a little bit of fat. Okay. It's one of those superficial deep fat pads, which we don't want to do, especially as we get older. We need those fat pads, right?
Right. Yep.
Or else we're going to look more saggy. And this is nothing against Morpheus. Morpheus is a great platform. This is nothing against RF platforms, but you have to make sure in certain areas of the face that you're not going too deep, right? To dissolve the fat. But with SoftWave, you're guaranteed to know that it's only targeting the skin and it's only lifting and tightening the skin, not dissolving any fat, which is what we need, right?
Yeah, that's great.
Which is good. And it has no downtime. You literally leave the same way you came in, which is great.
No, that's amazing.
So for patients that don't want a facelift, that just want to tighten some of that loose neck skin, which now that we have the FDA approval for platysma bands, we have so many patients coming in. We had them before, but now they're more comfortable expressing that they're not happy with the appearance of their neck. And so now I have a device that doesn't give downtime but yields amazing results with lifting and tightening the skin. So I'm very excited.
That's so exciting. I know we have I guess a version of that, like our
yes, with your BBL Moxie.
BBL Moxie, the skin tight.
Skin tight?
Yeah, it uses heat to tighten the skin. Yep.
Which is great.
Yeah. But I've been seeing incredible results with the SoftWave online.
Well, it's huge. And of course, anything that the Kardashians touch
Of
turns
course.
into gold. And of course, Khloe and Kim have, endorsed this lovely device as their favorite or their
Yeah.
favorite skin treatment so
Yeah.
far of this year. And what's so cool about it is that it has 9 different FDA clearances and you can use it on the entire body.
Wow. So you can use it on any area. Yeah.
You can. So you can use it on that loose skin in the tummy, post baby, right? You can use it in the arm, like the crepey skin in the arm that people don't like.
Yep.
You can use it on the thighs or the knees, right? To improve the appearance of that. And it's also FDA cleared for cellulite, which is really cool.
Ooh, I'd be so, you gotta get a cellulite model in there.
Yeah, for sure. We're going to work on that.
That's something that people ask
Quo
about
was
all
such
the
a flop.
time. It was such a flop.
Quo
was an injectable they came out with that we had such high hopes for cellulite. You could inject into the dimples of the cellulite and in hopes of improvement there, but unfortunately it was not what we'd all hoped for. Yeah.
It created a lot of hemostaining and it was lasting longer than it should. And so anyway, but very excited about SoftWave. We're going to be actually working on packages. We have InMode's Evolve X, which is their body sculpting device. So that's it's opposite of cool sculpting. It's using heat to burn fat, EMS, which is electrical muscular stimulation to tone muscle, and also RF to tighten the skin. So I'm going to combine that with SoftWave. You can actually get SoftWave and then do your first Evolve X session the same day.
Oh, nice. Yep.
The other thing about SoftWave that's so cool, you can do SoftWave and then do radio frequency microneedling same day.
Nice.
So and this is the big thing with SoftWave. If you have texture like pores, acne scarring, it did just get an FDA approval for acne scarring too. It's covering all bases, right? Yeah. However, I think RF microneedling does a better job with acne scarring. So so does Skin Pen.
Right. Yep.
But we're going to be pairing RF with SoftWave as well for patients that have textural issues, but also want more advanced skin tightening.
Right. Oh, that's going to be amazing.
Yeah.
You gotta get some models in there, get these results out.
Yes, queen. But it's so much. Regenerative medicine is literally exploded over the past year to 2 years. I mean, Sculptra has been huge for a few years now. But then with PDGFEB come into play, with SoftWave, with BBL Moxie, skin rejuvenation, get your face tight, right?
Right. Yep. And I feel like too, it's not a new concept. It's just that I feel like patients have more access.
The focus has shifted too.
They have more access to us on social media and stuff like that. So we can explain it better as to where, fillers and Botox are great, but we really have to be doing more in order to truly prevent aging.
Yeah. So back to patient education so important with these lifestyle modifications and aesthetics.
Yes.
The aesthetic lifestyle modifications.
Yes.
Instead of the cardiac lifestyle modifications.
Right.
But cutting down on sugar is really obviously important, right?
Yep.
That's huge. Like the sun, wear SPF, wear a hat, right? That's really important. Get your skin checks.
Yes.
Skin checks are so important.
Yes.
I think that it's not mandated or covered by insurance to get them every single year, right? For screenings, but definitely if you've had a history of tanning or a family history of melanoma, you definitely should be getting skin checks yearly, if not every other year.
And to our lasers, our IPL lasers, like our BBL and your IPL, people don't realize, even Moxie, these treatments can actually prevent skin cancer.
Yeah.
So doing those, there's a lot of benefits to that besides, again, just the visual. You can prevent that skincare from forming. And also for the people with melasma.
Yeah.
Remember that it's not just sun-induced. You don't have to just
hormones.
Hormones and heat. So if you're someone that's in the sauna, going to hot yoga, things of that nature, your melasma can flare because of that too.
100%.
Yeah.
Caffeine, alcohol, that all can make it worse. All the things that are fun, right?
I know, all the fun things. It's not fair.
I know. But it's actually really cool. There's been a few of my patients that have actually expressed to me they were huge vapors. They used to smoke, went into vaping, but now they're wearing nicotine patches.
Right.
And one of them is this guy in his 20s. He's like, I do his lips, and I was like, how are you? I'm like, oh my God, you look skinnier. You look good. You almost could tell. I could just tell there was a difference in him.
Yes.
And he was like, I actually stopped vaping and I'm wearing an nicotine patch. I'm like, good for you.
Weaning
you go,
off with the patch. Yes. Good. Good.
Yeah. Which is awesome.
Yeah. And we know it's not easy to quit, guys. My husband, he's going to kill me for saying this on here, but he smoked for years. We know it's hard to quit. And then he went to vaping because that's how you quit. You quit the cigarettes and you get on vaping, and then he vaped for years. So
it's funny. And he's a firefighter.
Right? Yeah. People yep.
Huh. Stop smoking, but still around the
Still
smoke.
around the smoke. Oh my God, I know. Don't remind me. He's like, his profession takes 10 years off his life, let alone adding cigarettes into the mix.
Oh my God. I just love Kevin.
I know.
When I
he's the
saw
best.
him, oh my God, when I saw him yesterday, he like just melts and like makes my heart
he's
so
so
warm.
sweet. He's so sweet.
I just love him.
But we know it's hard. And it took him,
Yeah.
I mean, he's quit smoking like 3 times at this point in his whole life. Like, you know, it's a lot, and we know it's hard, but you can do it. And he hasn't smoked because I made him quit smoking before we got pregnant. So,
oh my God, I love it.
This is my ultimatum.
You're so good. That's a good one.
Yeah. Right.
The other thing too, like with stomach and side sleeping, I have patients, and I'm sure you're the same way, Nicole, like after like getting full face rejuvenation, or getting like cheek or jaw filler, especially like in the posterior part of the mandible, you have to back sleep for a good, like, 5 to 7 days after. So that's almost like a good way to kickstart it, like, and I do the education, like really try, like, I know it's hard, but like try your best to back sleep, or like put 2 pillows and like lean or something like that, but don't do fetal position. And
don't be on your side.
Just making them more like aware and conscientious of it. It might like break a habit.
Right. Exactly. A habit that's worth breaking.
I know, but like, obviously guys, sleeping is so important.
So important. Yeah.
I know that. We know that we're so busy. Like, there's times I'm like, screw it. I'm side sleeping tonight.
No,
like,
yeah. And because when you don't sleep, like you said, the skin changes, but also like irritability and all that. Like,
oh my God, yes.
Yeah.
All of it.
Yeah.
The other thing, I also think we didn't talk about this yet, but obviously increased caffeine use. Obviously, you're dehydrating yourself. And also water, not drinking enough water can really dehydrate the skin.
Because you want to hydrate from within as well. Yep.
Yeah,
just putting it topically isn't enough. Yeah.
Because we know from the research with skin beads, skin hydration is very important. And if your skin's dehydrated, it actually causes more stress in the skin. It can cause it to age quicker.
Yep.
And wash your face at night, people.
Yes,
wash your face.
And put those active ingredients on. They are so important. Your glycolics, your salicylic, your retinol. All that good stuff. Wear it. Put it on.
I know. And if you're not liking retinol, use glycolic. At least use glycolic.
Yeah, exactly. Or try Alpharet. That's always a good option.
God, I promise your skin won't be reactive to Alpharet. Yeah. It's amazing.
Yeah.
Anything else, Nicole?
I think that's everything.
Oh, this was fun.
I know. You know who's going to love this? Megan.
She will love this.
Our wellness provider, Megan, here at Exhibit is going to love this episode.
I love it.
And she'll be listening to it being like, oh, I want to chime in. I have something to say.
Oh my God, I love it. But thank you guys so much for tuning in to this week's episode of the Fill Me In podcast. This was so much fun.
Yes. I know this wasn't fun to hear, but we're just trying to help, okay?
We're just trying to educate. That's all we're trying to do. Yeah, and we're guilty of some of these things, right?
Oh, yeah.
Like, what are you going to do? We live in the Northeast. There's sometimes I'm like, screw it. Yep. I'm not wearing sunscreen.
I'm going in the sun. And then we get burnt and we're like, why did we do that?
Why did we do that? And I don't show myself on socials for like a week until it's gone.
Exactly.
Wait, the worst thing I'll say though, like just recently I was in Florida like a month or 2 ago, and like I put sunscreen everywhere. I was like, oh, this is great. Then literally it was like day 3 and I'm like, God, my head.
No.
And then I literally went to itch it. I was like, oh, and I had a scalp burn.
Oh no, you didn't put any sunblock in your hair?
No. And of course, being a guy, like, I have short hair.
I feel like you've never really had short hair like this, so you probably didn't know to sunblock your head.
Oh my God, Nicole, it hurts so bad. Then it looked like I had dandruff for
That's the worst. Yep.
Ever.
Yep. Because it's like you can't lotion your hair.
No.
Had to peel.
Oh my God.
That was your trip that you saw Wendy Williams.
Oh, guys. You know what? Free Wendy Williams. And she just passed her psych test. Thank you, Jesus. I saw her in Chanel. For those of you guys that want to know, I saw her in Chanel and she was on her motorized scooter.
I love her.
Corey actually saw her. I kept walking. I was in my own world and he goes, that was Wendy Williams. And I go, huh? He goes, you don't pay attention. I'm like, sorry, what? And then I'm going, where is she? He goes, she's going into Chanel. I go, we are going into Chanel.
So are we.
So are we. But she looked great. Her eyes still looked very large and in charge, but that's just her. What are you going to do?
Yep.
I can't.
Well, sorry. I didn't mean to go off on a tangent there.
That's okay. I also saw Derek Jeter, for those of you that want to know.
What a week.
What a week. And I also saw a Real Housewives of New Jersey star as well at the one hotel. So Derek Jeter and the Real Housewives were at the freaking
It's a popular hotel. It's a popular hotel.
Is. She's a popular hotel, a very expensive hotel.
Yes.
Jesus, Mary and Joseph.
No, seriously.
Goodbye. All right, guys. Well, thank you so much for tuning in to another episode of the Fill Me In podcast. I'm Injector Jon.
And I'm aesthetic nurse Nicole.
All right. Till next time. Love you guys.
All I want.